This conference will now be recorded.
All right, so yes, again, my name is Kendall, and thank you for joining us. Today we have Brian Godfrey here from the UNC Geriatrics Clinic. He's going to talk with us about self-care. So I'll give you a little bit of background on him. Brian graduated from the Honors College at Indiana University of Pennsylvania with a BA in English. He then went on to obtain two master's degrees, a degree in publishing and writing from Emerson College in Boston, and a degree in social work from the University of Pennsylvania, and then became a licensed clinical social worker. After 4 years of providing outpatient counseling for underserved adults in North Philadelphia, Brian and his wife Janice moved to North Carolina for his new position as the sole social worker at the UNC Geriatrics Clinic in Chapel Hill. He lives in Durham with his cat Felicia and his dog Squirrely Temple. So thank you, Brian, for being here, and welcome. I must say I love your pets' names. That made my day when I read this.
Thank you so much. And you nailed the cat's name, Felicia. Exactly. Thank you, and thank you for having me. I really appreciate the opportunity to speak with y'all about such an important topic of self-care. I know this is something that is easy to neglect, especially when we have so much on our plate as we do right now. So thank you for taking this time to, hear these words about caring for yourself, and hopefully this will be some inspiration to put something into practice if you haven't, or to continue what you're already doing if indeed you already have. So just to dive right in here, see if I can get this working. There we go. So many people come to a seminar like this one because they feel a bit like the zebra here with the stripes falling off, and they go, I think it's stress. And I think you're right. I think that stress can have a very real physical impact on us, as well as, not to mention, the emotional and psychological impact. One thing that I like to kind of go through in the beginning is where I came from before I had this position. So as you heard, I was up in North Philadelphia doing community behavioral health, and this was mostly people with Medicare and Medicaid, or people who didn't have insurance. And these were also in some of the roughest, most underserved neighborhoods of Philadelphia. So naturally, I experienced a very high stress environment. And so, I had to find something to do, some way to cope with that if I could. Unfortunately, it wasn't that simple. I found myself in a situation where the demands were ever increasing. And you might find that you've lived through something similar, or maybe are right now with, I don't know, a global pandemic going on. Our demands are constantly increasing, that we have to do more with less. And I definitely have been there, done that. This can lead to some pretty unrealistic expectations of what we can and should do, which in turn, when you try to change this system, you might find that there's just no way to do so. At my previous position, I found that it was so extreme, at least the perception of it was so extreme, that when I tried to advocate to combine two forms together, not even to get rid of either one of them, since they were both required, but simply to put them on a single piece of paper, I was told absolutely not, we can't do that. So just to give you an idea, you may have experienced a system that was just this broken or set in its ways, and that can lead, combined with all these other factors, to burnout. So what I'm hoping we can sort of envision or create for you, or keep going if you already have it, is to change to a lower stress environment. If you can learn to say no, and you're at a company that actually allows you to say no when you need to, and then if you set realistic expectations for yourself and your management structure supports that, and if you're able to provide what we'll talk about today, mostly the proactive and supported self-care, then instead of burning out, you can actually grow. And I use the work example here because that's the one that's most familiar to me, but you could also take this in a personal sense too. In your own family, you might need to learn to say no or change realistic expectations to be more reasonable, for example. But let's back up a minute, because we're talking about stress here, but we haven't really looked into what it is or how it affects us. And I think that's worth doing. So this is Dr. Hans Selye, a guy who spent most of his career talking about stress. He had this quote, everyone knows what stress is, but nobody really knows. We all kind of assume we're talking about the same thing, but until he really studied it, there wasn't much out there to say what it was and how it affects us. In fact, when we say the word stress, we're usually referring to chronic distress, but there's actually much more to stress than that. You know, we often assume that stress is bad, for example, and that's simply not the case. We can have good stress that motivates us, as we'll talk about here in a moment, or pushes us to important action. And it might not be distress and it might not be chronic. It might be something that just happens to us once. At the end of his career, he defined stress this way: the non-specific response of the body to any demand for change. And I like to highlight that it is a response of the body, that this is a very much a psychosomatic reaction. It's things happening in our mind that impact our body in a very real way. Even if it's something that we're manufacturing in our mind, it can still have that same impact on our body. And I also like to stress that there is one way you can be without stress, and that's to be dead. So we're not striving towards that. It's going to get us all one day. But for now, let's enjoy what we have and try to make it the best life we can. Not by eliminating stress, which is impossible, but by reducing it and changing it so it can work a little more for us. Now, I'm certainly not a doctor or even a nurse, so I won't pretend to understand a diagram like this. But what I do take from this is a couple things. That in general, we have these two systems in the body that help to manage our reaction to stress. The one over on the left you see is rest and digest, what some people call the parasympathetic system. And really, this system is designed to do just that. It's designed to cool us down, let us relax, let the body work the way it's supposed to. And we're like this most of the time, at least that's the idea. And then the sympathetic system, the opposite, is the fight or flight. Some people add in freeze to that. The system in the body where you've encountered stress and you need to respond to it. In order to respond effectively to stress, your body is going to have to amp itself up a bit, right? If there's a tiger that suddenly shows up, you need to be able to do something, fight it off, run from it, climb a tree, whatever. And you don't have the option to sit and think about what the best action is. You have to do something immediately, and you have to have the strength and endurance to be able to do it, even when you might not really have those things. Under the sympathetic nervous system, people have done incredible things. I mean, you hear stories about women lifting cars to save someone who's pinned underneath it, something they could never do. I don't know if that exact example is true, but it hammers home the point very well that our body can become much, much stronger, and that is definitely true, than it normally would. But then we need to go back to the rest and digest to properly recover so we can continue on normally. Because if we didn't and we stayed in fight or flight, our body would quickly burn itself out and we could actually kill ourselves with that. So these two systems crucially need to be in balance. Stress as a reaction to demands also has an impact on multiple systems in the body. It's not even just that complicated set we just looked at, it's hormones too, and we're still coming to understand these. You've probably heard of hormones like adrenaline and maybe even noradrenaline, but you might not have heard of glucagon or some of these others. And we're very much still understanding these, but I think the glucagon in particular is interesting to me because it's related to blood sugar. And this is something, of course, a lot of Americans struggle with. And, you know, we know it's correlated to weight and lack of activity, which we tend to have in this country. And especially during lockdown, I'm just wondering what's happening when our stress response is being triggered. We're at home and maybe eating more or differently than we usually do. It'll be interesting, I guess, to see what happens with all these systems. I think it's just important to know, again, that this is impacting us on a physical level. And the way you're feeling isn't just because of what's happening to you or your mind. It's actually real. It's in your body. And speaking of stress, right? If anyone's afraid of flying, you might have gotten a little jolt right there. I think it's interesting how we perceive stress, though, because it is worth saying that stress isn't something all by itself. It's very much related to how we perceive it. So if I were to ask, for example, what number of people experience flying related anxiety, like as a percent, for example, you might get something like 1 in 4 or 25% people have some kind of flying related anxiety, at least according to this NBC News article I was looking at. But what are the actual odds of dying in a plane crash? They're really, really small. And just to put that number in perspective to you, your odds of dying in a fall is about 1 in 114, just incredibly more likely. And I know because here I work in a geriatrics clinic, I hear about people falling quite frequently, and it can even be fatal. But the plane crash, I've never met anyone who was in a plane crash or even knows anyone who was in a plane crash because they're so rare. We can go years without them. What about suicide? Well, if you're looking statistically, the odds of you killing yourself are about 1 in 88. And if you want to really get real, the odds of heart disease, dying of heart disease, it's about 1 in 6. So I like to ask here, what's more dangerous, the plane or the food that they serve on the plane and the fact that you're sitting still on the plane? You know, I think the point of all this is that our fear can be very much out of proportion to what is statistically dangerous. I know there's been a lot of Americans over the last decade or two who have been really worried about terrorism, for example, and the odds of being killed in a terrorist attack are incredibly low. But it didn't feel like that after 9/11. I can say that much for sure. And I think that it's important to pay attention to the fact that our perception of stress may not be proportionate to the actual danger that's out there. One thing I'm seeing a lot right now is when people have trouble negotiating the risk of bringing someone into the home to help care for a loved one, or even if they'll go into the home to provide that care, given the risk of COVID. And we don't really have good numbers on this. We don't know exactly how risky it is. So of course, this whole becomes much more stressful for all of us. Let's look at a few of the factors that can influence perception. They're important things to be aware of because they impact all of us. One thing that is seemingly human nature and very strong for some people is noticing the negative. If you identified as an optimist, for example, and you got a promotion at work, you might respond like this guy: more money and more power to make a positive contribution. But if you're a pessimist, you might respond more like the woman there: more stress and further away from the reason I chose this field in the first place. It's the exact same thing happening. You got a promotion. But the fact that you might be focusing on the negative or being influenced differently depending on how you were raised and what your mind is working like, it can dramatically change how you look at that exact same event. And that's very important to keep in mind, that we're not looking at facts here, we're looking at how we interpret and understand those facts, and that's what actually influences us. As human beings, we tend to make these snap judgments, and they tend to stick around even longer than they probably should. You've probably heard of or seen some of the research that we tend to make judgments of people within seconds or perhaps even fractions of seconds upon meeting them. And this is probably built into us. We need to be able to recognize very quickly what's a threat and what's not. And in particular, we seem to be programmed to recognize people and people's faces in particular. When we see a face, we tend to make a judgment about that person very quickly, and it can stick around even when evidence goes against it. So if you're aware of this tendency, you can start to, change it if you wish and counteract it. And, if we don't even think it's there, then, well, we certainly can't respond to it, can we? One thing, another factor of perception is confirmation bias. This is that we tend to seek out evidence that supports our theories and ignore evidence that does not. This comes up a lot in politics, where as people are looking out for articles, for example, or news shows, or something on the news, they're very likely to pay attention to the things that agree with them, and very likely to not pay attention to, not even watch or pick up, the things that don't agree with them. So we often end up in this little bubble where everything feels very true, but there's a whole nother world out there that we're either not aware of or completely unwilling to engage with, and so that can lead to a lot of bias in our thinking. We also can tend to assume that other people are more similar than different. And this is an interesting one, right? Because we are all very similar on a fundamental level. Genetically, we're all incredibly similar and probably share a common ancestor. But at the same time, culturally, we can develop completely differently. And even within our own minds, we can develop incredibly differently. So assuming that because something is like this for us, it must be for other people too, may not be accurate. Our expectations tend to shape our experiences. Here, I don't know if you know, but there's a new Matrix film being filmed or made right now, the Matrix 4, I guess. And I still remember when the first couple ones came out. The Matrix one was this amazing film. It blew everybody's expectations, bullet time, fancy special effects. It was amazing. And people went into the second and they had very high hopes. And many people were very disappointed by the second. Personally, I went into the second movie hoping to see the same cool special effects that I saw in the first one. I was not disappointed. It was beautiful. Never mind that certain parts of the plot arguably made no sense. At least my expectations were met. And so I was happy with the movie. I don't think many people can say that. Focusing on your own experience, right? Many of us have said or heard people said, well, this is how it worked for me. Well, it may work differently for other people, and that may be due to factors beyond our control, but focusing on our own experience seems to be just a human trait. We tend to have multiple biases, and we're often unaware of them. But if you've ever heard someone say that they're unbiased or impartial, I'm sorry, they're not. Every single one of us has built-in biases, and it's amazing how deep they can go. We just installed some new kiosks here at the geriatrics clinic. I mean, many people, when you tell them to sign in on the kiosk, they literally cannot find it. You can point at it, you can say, touch the screen, and they don't see it. Their brains are not processing it because their bias is when you come into a clinic, a person will check you in. When that bias is not met, they cannot perceive the new information. And that's not because of mental illness in their case, but next one on here is mental illness. This can dramatically shape how we see the world and what causes us stress. Imagine if you're dealing with everything that we're dealing with in the world right now, and you're also carrying around thoughts like these. I can't do it. I'm not worthy. I must not make a mistake. I'm not good enough. Nobody loves me. There are people who are carrying around thoughts like that right now. And particularly if you're trying to be a caregiver to someone, if you yourself have thoughts like that weighing you down, you can imagine it might not take much stress for you to feel overwhelmed, because you would be overwhelmed without that external stress. But that doesn't mean all stress is bad, and I do think it's worth mentioning this. This chart shows that there can be a certain comfort zone of stress, and then beyond that, you can move into a stretch zone. If you go even further, of course, you can hit that panic zone, and that's not helpful for anybody. But if you are able to give yourself just enough stress that you're doing something interesting, you're learning something new, you're engaged in something, you can even find yourself in this state of flow where you feel like you lose track of time, you're just so engrossed in this activity. And that's beautiful. This is something that we seem to crave as human beings. And I think it's an amazing thing, but it's a difficult balance, because if you're in the comfort zone, you just may lounge around and not do very much. I mean, there's nothing wrong with that, but if you want to learn and grow and kind of fulfill yourself as a person, then you probably won't do it just staying in your comfort zone. A little bit of stress could be helpful. This is just another way of looking at the same thing, right? Where you're looking at your current amount of stress and your ability to function. When you're on top of your game at the top there, you've got just the right amount of stress. If you have too little stress, you can be bored, apathetic, you can even get depressed. If you have too much stress, you can get panic, anxiety, frustrated, burned out, and depressed. But there is this middle ground, and this is often very difficult for us to meet. I don't think it's impossible, although there may be moments in our life when it's impossible. And I think that's okay to just accept that, but to realize that the answer is not to go to either extreme, it's to find something in the middle. And oftentimes those are things that we enjoy doing, so those can be quite rewarding as well. The roller coaster would not be something I enjoy doing, but it is something many people do enjoy. It's why there's so many of them. People stand in line for them. And the reason that they enjoy them so much is that they get that mild acute stress reaction from it. Again, stress not being a bad thing in this case, right? So they experience the mild stressor and their sympathetic system kicks into gear to help, get them ready to do what they've got to do on this roller coaster, and we scream and yell. And then as the thing is ending, we need to come back to baseline, right? So as the coaster comes to a stop, we slow down to parasympathetic system kicks in and helps bring us back to the equilibrium that we need. But imagine if the roller coaster never stopped. That would get old real quickly and then probably stressful as you're trying to figure out, how do I get off this thing. What do I do? And for many of us, that's kind of what we're experiencing. It's this chronic, consistent stress. We're worried about our health, we're worried about work, we've got all these concerns about the world and politics and the virus and all of this. And this can result in a chronic stress response. I've heard so many people talk about how they're so tired and overwhelmed right now, and they just don't understand quite why. And it's because of this. It's that we've had this moderate stressor, and maybe even severe for some people. And because we've already been under a lot of stress, our body can't quite return to baseline. We get this big spike whenever something triggers us and we feel it. We might lash out at other people, because we're energized. We've got all this energy. We got to do something with it. And then we'll crash. And we can't come back to baseline. We try to get to normal and we just can't because our reserves are already depleted. I like this model because it helps remind me that we have to fill our cup back up again if we're going to help others, because it's been depleted and it needs to go back to baseline. If not, there's going to be consequences for us in terms of our mental and physical health. What do we worry about? Well, nowadays, I think we should add politics and the virus to this list. But the typical list over time of what people worry about has been, no surprise here, money, work, family, and health. The things that we're all concerned with. The older data, I'm sure things have changed now. But it's important to remember there's also social determinants of health. Many of us are in this field are very aware of these. I just highlight a few at random here that women are more likely than men to report having a great deal of stress. And African Americans, especially if they have low income, report not only a greater number of stressful life events, but also greater distress coming from those events than their white counterparts do. And any of the spokes on this wheel and many other things can influence our stress level. So I do want to be clear as well that if you're feeling a lot of stress, it very well may not be your fault. If you've been put in a societal position that you're already more vulnerable, then the exact same amount of stress that doesn't affect someone else will affect you because you're already at that disadvantage. All right. And there can also be traumatic stress. I think it's important to mention this, that for many people, being isolated from their loved ones during this pandemic might even qualify. The fear that we've experienced. Typically, we think of a soldier and something like PTSD, but traumatic responses can happen to any of us, and it doesn't need to be a big event in order to trigger it. But once it does, it works similarly to the idea of chronic stress, except turned up to 11. Where the response that we try to give is very severe and our body tries to overcompensate for that to bring us back to baseline. And then it crashes because it simply can't do it. And the stress is still there, at least in our minds. And so it doesn't take much for us to be triggered again. And we never return to baseline. In fact, some people can stay much above it. And whether or not this is diagnosed as formal PTSD, I think it's important to realize that a lot of us have experienced trauma in this recent pandemic. And there's a great deal that we need to do to take care of ourselves because of that, and help our body come back to the equilibrium that it's currently not able to on its own. So you may be wondering at this point, oh my gosh, am I burned out? And maybe, maybe that's why you're here. Or maybe you're just interested in preventing that from happening in the future. These are some of the common signs of caregiver burnout. So at the very least, you can pass these on to other people. And I'm very happy to, and this is being recorded, so you'll have access to this later on. I can send slides if anybody needs. But any of these signs can indicate that you're at a higher risk for burnout or starting to experience it already. Number one, if you no longer find pleasure in things that you once found enjoyable, and you might recognize this as a symptom of depression too, which can often go along with burnout. If your family and friends have expressed concern about your well-being, this is an interesting one because we tend to be very focused on our own experience and we tend to feel like we know best. And in some ways, maybe we do. At the same time, the people that know us well and are observing us are sometimes more able than we are to see change. It's kind of like being in a pool. It might be shocking when you first get in, but then you get used to the water and it's comfortable to you. And you don't realize when it gets colder and colder, perhaps, and someone else has to point that out to you. Maybe we would, But then again, maybe it's actually colder than we think it is, and we're not aware. You know, sometimes people lose sensation and so on and so forth. But the point is that family members may be more able to see when things start to go wrong than the person themselves. And we as external specialists or caregiving advisors, I guess, might have another removed perspective where we can look at a family dynamic and say, wow, you guys probably don't realize it, but this is what we see going on. You may be used to it, but it's new to us, and so we notice it more. You might find that you're getting negative feedback at work, and indeed, your performance may be worse, and that might be okay. I mean, maybe you should forgive yourself under the circumstance, but if you're getting that negative feedback, it could point to the need for increased self-care too. If you're having trouble with your spouse, now this is something many people experience, and they've probably, have that sensation of when they're under more stress that their conflict with their significant other tends to increase. So again, just something to pay attention to. If you find yourself snapping out more or getting frustrated at little things, it might be a sign that you're starting to burn out, and we need to pay attention to that. If you experience intense and recurrent emotions, they list a few there: anger, sadness, worry, and fear. I think any intense emotion, if it tends to show up over and over again, it's trying to get your attention. This is something worth paying attention to. If you have difficulty concentrating, we're all depleted right now, and so I think a lot of us are having that, but if you're noticing it, it could be a sign. If you're having trouble sleeping, you've had dramatic weight changes, if you're suddenly having more health problems than usual, a shocking number of physical health ailments can actually be attributed to mental health and stress levels. I've seen some estimates that were crazy high. It was like between 60 and 80% of all PCP visits. If you were to really boil down what's the cause of this problem, it was stress. We live very stressful lives, and so we need to pay attention to that, be aware of that, and then take care of ourselves. And then finally, if you find yourself using a substance to cope, I think we need to include alcohol in this and to pay attention to the quantity that we consume. I think it's very common for people to self-soothe with things like alcohol and nicotine. And, maybe there's nothing inherently wrong with that, especially if it's in moderation. But technically alcohol's a poison, right? We ingest it because of its effects on us. But if we get too much, it can be very dangerous. So to pay attention to our levels of consumption and why we're consuming can be very enlightening. What is self-care? What gets in the way, and how can it work for you? So we've mentioned this term, this idea of self-care. I think it's worth defining, even though it may feel a little obvious, because we're so good at fixing other people, or at least we want to be so good. We try so hard to fix other people, and very few of us are willing to put in the time and introspection to take care of ourselves. So I define self-care here as any activity that we do deliberately in order to take care of all aspects of ourselves, our mental, emotional, and physical health. All of these are important, and you're welcome to add more to that definition too. But I think the key takeaway there is that we're doing this deliberately. This is something we're doing on purpose to take care of ourselves. So I hope you'll approach it with that intentionality. I think a lot of the things that we approach without intentionality are probably captured in here. These are techniques among millennials, but I think we can generalize them to most people in general. We tend to watch TV, we go online, we nap or sleep, we eat, we drink, we smoke, right? These are all things that we just do kind of maybe even automatically to help cope with stress. They are self-soothing skills, and there's nothing inherently wrong with them, arguably. But the trouble is we tend to overindulge and we tend to avoid the real challenge that is facing us. If we were instead to self-monitor, to pay attention to what we're doing and how the world is affecting us, as well as what we do in response to that, then we can choose to do something a little more intentional and take care of ourselves. When I talk about self-care, I typically hear that there are three main barriers as to why people can't possibly do what I'm talking about. I feel like a lot of people come to a presentation like this and they already understand taking care of yourself is important. Yes, I get it. But, and then what they say next could be really interesting, right? Could be, but I'm too burned out to do anything. I'm at my limit. What do you want me to do? I'm done. Or they might say, Well, I can't take care of myself because I have to take care of someone else. Other people come first. Or they might simply say, look, there's no time in my day as it is. How could I possibly add in anything else? I think it's worth paying attention to all of these to see which parts of them are justified and if there's any way that we can move forward with self-care despite challenges like this. You probably know implicitly it's possible because you've seen people take good care of themselves before. Maybe you're even doing it yourself. But if you do find yourself getting caught by one of these barriers, let's take a closer look at each one and see if they hold up. So you don't have to be like the 1 in 5 Americans who say they don't do anything to manage their stress. And this is how many admit it. I think the real number is probably a lot higher of people who don't engage in intentional self-care or don't do it nearly enough to support their own actual well-being. So number one, if you're too burned out to do anything else, well, sometimes people even feel guilty about this. You know, they're very, very burned out, but they feel like, well, I'm not doing that much. I don't have that much stress in my life, so why am I burned out? And to that, I would remind you that it's all about perception and that time has a real powerful impact here. Imagine you were holding this glass of water for just a minute. You can probably do that without much difficulty. But if I asked you to hold it for 5 minutes or 10 minutes or half an hour, this entire presentation, the rest of your day, I mean, you get the idea. That single glass of water is going to get unbearably heavy. You will have to put it down or your hand will fall off. You'll go numb, you know? And I think that's so important. If you're feeling like you're at that point, regardless of what caused your stress, if you're at that point that you can't hold it another minute, well, I have to say congrats where it's due. You deserve credit for being introspective enough that you know your limits and you know you're already beyond them. If you're beyond your limits, that means that the actions that you take are not going to be fully thought out because you don't have the brain power for that, and your physical health is going to start to suffer if it hasn't already. If we continue to burn that gas, eventually it will run dry, and then we'll burn ourselves because there's nothing left to burn. So it's okay to need help, but you owe it to yourself to actually get that help. If you need that help, take that one step right now, whatever that might be for you. Maybe it means making that doctor's appointment and getting to it. So you get one chance to talk with your doctor about what's going on and see if anything can be done. You might just decide to share your struggle with someone else. Some people feel like sharing with other people isn't helpful because nothing will change and you don't want to burden them with your problems. And that can happen, but the opposite can also happen, where when you share your struggles with someone, they might actually connect with you about that. Maybe they've gone through something similar, or maybe it will just deepen the bond between the two of you that now you're sharing a common experience of that moment. People who care about you often want to know about what's going on in your life, and choosing not to share, yes, it means you're not a burden, but it also means you might not get the help that they're actually pretty eager or even desperate to give you. And this is things that I talk about with caregivers quite a bit. If you're too burned out to do anything else, you might need to attend to your mental health needs. And this might actually be a therapy session that you set aside once a month or whatever you can manage. Maybe it's just for 20 minutes, they can be that short. And you can decide how to tackle this incredible challenge that's before you. Or maybe that visit itself will be how you tackle that challenge. It can be so helpful to look at what has caused your burnout and choose to do something different, anything different that you can. You know, some people, all they feel like they can manage is a single minute where they will go to the bathroom, close the door, lock it, and take deep breaths. Well, that's something. And you just proved that you were not too burned out to do that. So, very powerful stuff. Number two, one of the most common ones I hear is other people come first, right? I can't care for myself because I'm too busy caring for fill in the blank, someone else. Well, you've probably heard on the airplane when they give the announcement and you're getting ready to take off and they go, you know, if oxygen masks were to drop from overhead, make sure you secure your own mask before assisting someone else. And I don't know about you, but the first time I heard that, I'm like, yeah, bull. Like, no, I'm not doing that. If there's someone next to me that needs help, I'm going to help them and forget about me. What do I matter? I think a lot of our caregivers actually feel the same way, that they would sacrifice everything for their loved one, and they already are. But the trouble is, and I think this example shows it well, If you don't put on that oxygen mask and the cabin loses pressure, you could fall unconscious. And now they don't have their mask on. I mean, or maybe one person does, but what about the other people who need help? And what about the fact that now you're unconscious and they're there? So physically they're okay, but emotionally they're at their wit's end. What are they going to do? Are they really just going to sit there and keep the mask on quietly with you unconscious in the seat next to them? Things to pay attention to, right? I realize the metaphor can go too far, but you get the idea that this is about, if we don't take care of ourselves, then we can't help others. But the opposite is true too. If you nourish yourself, then you can flourish, and other people will really respond to that. And the one that strikes me the most is, you can't pour from an empty cup. Take care of yourself first. We tend to know when we're empty, but we try to pour anyway. It often doesn't go well. You need to have something in your tank before you can give. Here are some powerful little pieces that I found on tinybuddha.com. This is by Jo Ritchie. She found that the emotion of guilt, we particularly feel guilty about putting ourselves first, that emotion of guilt can really drag us down. And these are some of the misconceptions that many of us have as to why we can't put ourselves first. Sometimes we think that self-care means being selfish. If I'm doing something just for me, then clearly it doesn't impact other people. Except that's not true. When you are in a better place, then you respond better to other people. Those interactions can be more smooth at best, or at the very least, and then maybe even deeper at best. So actually, doing something for yourself is doing something for someone else. It's just not as direct as we might want it to be. We might confuse rescuing with caring, especially when you're taking care of someone who still has capacity, or when we're counseling a caregiver of someone who has capacity. There may be this strong impulse to try to save them, right? To just fix everything. But it really can't work that way. When someone has capacity, they have the ability to make their own decisions, and that includes bad decisions. That includes decisions that we don't agree with, but they still have the right to make them as a human being. That's what we really believe in this culture. And if your family is different, then awesome, go with what your family believes. But in general, we want to give people the freedom to make their own choices as long as they possibly can. So it's fine for us to express care or even concern about someone, but to try to save them or solve their problems for them, number one, it often won't work. And number two, it actually could be disrespectful because you're trying to take away their agency for your own convenience. And that's not putting other people first at all. So we need to think about this. Oftentimes we become accustomed to relationships that are based on neediness rather than true love, which I would sort of define as a reciprocity. If this is a relationship where both people are getting something meaningful out of it, and it's not just one person needing and one person giving, I think that could be a more healthy relationship. But of course, things are different for everybody. And if it works for you, that's awesome. But I would just pay attention to what we get back from a relationship. And there might be relationships in our life that we're putting people first when really we don't even value that relationship. And I think that's okay to look at that and to reevaluate that if we need to. We often don't realize that we actually teach people how to treat us. If someone is always speaking rudely to us, but we never say anything against that, we never indicate that it bothers us in any way, we simply avoid them, that might temporarily solve the problem until it happens next time, but it does not teach them that it's unacceptable to speak to you in that way. If we were to confront it and say something even immediately, like that you can't talk to me like that, I won't put up with that, I'm better than that, I'm worth more than that. These can be very hard and it can lead to conflict in the moment. So there can be skilled ways to do it, and people can learn this in therapy. But I think it's a valuable point to say that confronting something and indicating when something is not allowed, to let people know when your boundaries have been crossed and to enforce that moving forward, this can be very powerful. It shows respect for yourself, and it also, it really embraces this principle that we are teaching them how to interact with us, what's okay and what's not okay. And it's just how it works. That's why we see people who can get away with a lot with one person, but not so much with another. They have said that. Some of us will give, but we also expect things in return. And I think it's important that if you choose to give, you must give freely. If you expect in return, then it's really only half a gift at best, isn't it? That you're like, I'll give you this, but, and then I want something back. If you want to do that as a contractual agreement, by all means. But if you're just quietly expecting something in return, I think you're setting yourself up for disappointment. You're probably not going to get it. So if you choose to put other people first and sacrifice, and you're okay with that, then awesome. But if you're kind of quietly expecting that they'll do something back for you, I don't think that's fair. You're the one choosing to give. So give freely if you choose to give, and be glad you did. We don't realize our worth. I kind of hinted at that before, right? If we feel like we're not worthy, we're not important, other people are more valuable or more productive than us, then why would we put ourselves first? We don't matter as much. The truth is just the opposite. We all have incredible worth, and many of us haven't even realized what that is or how powerful it is. It's sad to think that it is often not until people are gone do we realize how deep their connections really went. But hopefully we'll realize our own self-worth, and then we can make that decision to put ourselves first, because our loved ones and the people we're caring for, they matter, but so do we, equally. And probably the most common reason I hear why we can't practice self-care is that there's not enough time. Well, I hate to break it to you, but if this is your to-do list, there's a problem. You cannot do everything. So how do we decide what to do in your day and what not to do? Because ultimately, this is what it comes down to. We're given these 24 hours, and it's based on us to decide how to spend these. Sure, some of these things are written in stone, we have to do, but I think they're fewer than we might think. You know, we might assume that we have to even do things like spend a certain amount of time with our kids or a certain number of hours at work. Sometimes these things can actually be flexible, even under things like FML, you know, family medical leave. So I think it's important to remember, number one, you can't do everything. And number two, you need to be very purposeful in how you decide what to do and what not to do in your day. Here's a little chart that can give you an idea of what to do, what not to do, right? So if something is important to you or your loved ones and it's urgent, then by all means, it's the red square, do it. Those are both high, we need to do this right away, right? What if it's very important to you or your family, but it's not urgent? Well, you put it on the schedule. What if it's something that's urgent, but it's not important to you? You might delegate that. It does need to get done, but it doesn't have to be by you. And this is something that a lot of caregivers in particular will struggle with, giving up control in order to get some freedom and peace of mind. We want both, but remember, we can't do everything, right? So we may have to reinforce with people, you need to let so-and-so take care of this. I know it won't be done the way that you do it, but it's good enough and it needs to get done, and your stress level's too much. You know, so it could be important, it could also be a stress level thing. And then finally, if something is not urgent and it's not important, rather than scheduling it and putting in a basket that you'll do someday, I would recommend dropping it. Just admit to yourself, look, I'm only human, I can only do so much. And this, it's not important enough, it's not urgent enough, it's just going in the trash. I'm sorry, I can't do it. And you know, perfectionists hate to do that. I'm among them, it drives me crazy. But sometimes, especially in trying times like this, we have no other choice. It's very important when it comes to time to notice where you're currently spending your time, and also to pay attention to your values. What's important to you? If you say that, for example, your kids are the most important thing in your life, where are you spending your time? Are you getting that time with your kids? And if not, how come? What are you actually putting in priority above them? Or the other way around, maybe you're spending too much time with your kids. You didn't realize how long things with them would take, and you're not actually getting the time that you need for yourself. You don't have to put your kids first all the time, for sure. And we need to accept that you have limited energy. You literally can't do it all. So we have to look at your values and then say, okay, based on my values, what do I choose to do? And if you're intentional with this, you tend to not feel like you don't have enough time because you chose the things that you would fit into your day and you knew the things that wouldn't fit, so you didn't stress about them. It's all about priorities. Time management is all about priorities. What do we value? And therapy can actually be very helpful in helping you figure out what are your priorities. All right, how to do this. This is something you can do. Many of you already are. And just give you a few things that you can do, hopefully no matter your situation. The Academy of Medical Royal Colleges in the UK defined exercise this way. It said if physical activity was a drug, it would be classified as a wonder drug. Twice as many deaths are due to inactivity than due to obesity on its own. You know, a lot of people say it's the obesity epidemic. It's also the inactivity epidemic. We're not moving very much. We're sitting a lot, and exercise is such a powerful force when it comes to physical and mental health. It would truly be a wonder drug if it were a pill. So if you can only do one thing and you want to reduce some of the symptoms that you see here, I would recommend exercise. And it doesn't need to be something super intense either. I mean, you might picture going out for a run, but it certainly doesn't have to be that much. Anything that you do to bring movement or activity into your day can be helpful. Don't think it has to be a 20-minute cardio session at the gym. It can be something as simple as parking a little further or taking the stairs. Any physical activity has been shown to have some benefit. Sleep is crucial too. Many of us struggle with this, and so there's some ideas here of different things you can do to improve your sleep. If you're interested, you can just Google sleep hygiene, and you'll see lots of tips like this. A lot of times, stimulants like alcohol and nicotine, or even big meals, can contribute to our difficulty sleeping. And I think it's worth mentioning some of these things in particular. You know, I'm certainly not a nutritionist, so I defer to them, but from what I've been hearing, it sounds like there's a lot that we're learning about our vulnerability to certain things, in particular, sugar, caffeine, and processed foods. They're in abundance in our culture, and they don't seem to be doing us any favors, especially when you compare us to cultures that don't have these in such abundance. It's important to remember, for example, that the half-life of caffeine, when about half of the caffeine is out of your system, has been about 4 to 6 hours. So what this means is that caffeine could still be affecting you in a small way up to 12 hours after you consume it. So you might think twice about that second cup of coffee in the middle of the day. I know a lot of us feel like we need it to get by, but maybe that's actually a crutch and we need to use some other self-care because it could be harming our sleep, which then fuels the whole stress cycle. When it comes to sugar, which is delicious, the World Health Organization recommends that we have less than 25 grams of sugar per day, which is way less than in a single can of Coca-Cola. And many of us, when we have a Coke, we don't have a 12-ounce can, we have a 24-ounce bottle or something larger, right? So be aware of even tea can have caffeine in it, and this can impact things like sleep. The reason I stress nutrition and these substances is that when we're under a lot of stress, we tend to make poorer choices in general, and that can cause us to overeat or eat things we shouldn't, which can result in weight gain, which can increase our propensity to stress and health conditions and fuel this whole vicious cycle. But to break out of that, things like the fitness, eating better, and also connecting with others can help break this cycle. Lots of studies have shown we need other people. Social support seems to moderate even genetic and environmental vulnerabilities for things like mental illness. Genetics are not set in stone, and your environment does not control you. It's actually more complicated than that. And the way we connect with other positive people can make a big difference in overcoming what might otherwise be destiny. Connection is why we're here, said Brene Brown. We are hardwired to connect with others. And so anything that you are interested in to connect with others in a way big or small, whether virtual or in person, I think could be really powerful. And we're seeing even now with things like this, our ability to use online tools to connect with other people. I know time is a little short, so I'll go through these quickly, but I do want to point out a few things of mental health. This is my background as a therapist, and so I see things like this a lot. A lot of people will overestimate what we can do, and this leads to inevitable failure. We never could have done what we set out to do. It would be more helpful to accurately estimate what your abilities are and what the needs are so you can feel successful and reinforced. We often compare ourselves to others, especially on things like Facebook, social media. We notice the negative, and that can lead to low self-esteem. But if we were instead to compare ourselves to how we were in the past, that even today we're better than we were yesterday in one tiny little way, then we're recognizing growth and change. When you try to meet the expectations of other people, you'll feel weak, resentful, and even regretful because you didn't follow your own path. But if you try to meet your own expectations, you can feel powerful and motivated. Finally, if you care only for other people and you try to do it all, you very well may burn out. But if you take care of yourself, you set limits and you ask for help when you need it, then you can actually lower your stress level. Balance, this acronym. Every day we strive towards balance, and it's difficult. I won't focus on all of these, but I will highlight again, no is a word you can learn to say. Many of us need to get better at delegating, and we need to learn how to say no, to allow other people to share the load and let go of unrealistic expectations. All easier said than done, but a therapist can help if someone's having trouble. Self-care may not transform you from someone hopelessly overwhelmed to someone who's achieved enlightenment, but I do think that there are little pieces that we can do to improve our day. And so as I wrap up here, I would just encourage you to think about, maybe it's time for that spa day that you've been putting off for so long. Maybe you'll finally start that hobby that you've been thinking about. Maybe even the pandemic is the perfect time to do it. Maybe you'll decide it's finally time, since we can't really get out of the house right now to be around people, maybe we can still go out in nature. That actually could be helpful. So, whatever you choose to do, whether you choose to practice things like mindfulness or guided meditation, these are just simple skills that you can do almost anywhere, even sitting in an office. You can do some simple progressive muscle relaxation to tense up and then feel the release, and do a paced breathing exercise. For example, when you breathe in to a count of 2, hold it for a count of 3, and breathe out slowly to a count of 4. Things like that can bring surprising amounts of relief without much effort. So if you're interested, you could Google any of these or simply search for something like self-care strategies. You'll find lots of ideas if you need any, but a lot of times we already know what we really want to do. Just to share my own self-care, I love being out in nature. This is actually my beautiful wife, Janice, up at Turtle Hole. It has this beautiful little swimming hole, and there's a little bit of rapids nearby. And no, nothing dangerous, but you can actually lay in these rapids, and it's like a natural jacuzzi. Just fantastic on one of these ridiculously hot days we get in North Carolina, to go out there and enjoy the water. Nothing like it. And sensing my water theme, continuing with that, this is a video game called Subnautica. I love playing video games, and this is a fantastic one where you can just explore an underwater world. There's just enough tension to keep things interesting and just enough serenity that you can really relax in this world. So whatever you do, I hope you'll take a moment for it. I hope that you will consider bringing in some additional activity into your day and looking at your priorities and getting whatever help you might need to make these changes, and make sure that you don't burn out so you can continue to enjoy life as fully as you possibly can. That's it. Thank you all so much.
Wonderful. Thank you so much, Brian. That was wonderful, and I think you really got to the root of self-care and kind of what we need it for and how we can achieve it. So thank you so much.
Such a pleasure.
Yes.
Thank you.
Thank you.